Hi, What the Health Tech listeners. I'm your host this week, Matt Fewster. This is the podcast where we tackle some of the trending topics, ideas, and best practice in health and social care. This week, we're back speaking to Manhaes, who's heading up LFPSE for the NHS Improvement Team, and Paul Ewers, who's Risk Manager at Milton Keynes University Hospital NHS Trust, to continue the conversation we've been having around LFPSE and the implementation. So, Paul, I basically just start by saying well done. So you're the first trust to go live, I believe.
Yeah.
And I guess the launch of LFPSE was a bit of a double whammy for you because you had to swap your systems over as well. So you're going live with Radar and LFPSE at the same time. It must have been a bit of a challenge, I guess.
Yeah, it was a challenge. It's been a positive one, but it was it has been a challenge. So I mean, it kind of started really several years back where we had our existing system, and we wanted to find a system that was able to do what that could do. Obviously, moving it into more up-to-date technology, but also to be able to do other functions. So audit and document management were two things that we were very interested in moving across into the same system. So kind of during 2021, mainly, we looked at several different systems and made decisions to move across to Radar. And then quite early on in that project of looking at the implementation of that, we started looking also at the LFPSE and moving across to that as well. So it was quite a challenge. There's still challenging moments, as I'm sure you'll know, and any implementation of an IT system, there are challenges and
absolutely.
Going, but
I mean, wise choice though, picking Radar, but yeah. Not that it's a good plug. So tell me about the successes then. What you're happy with, what's gone really well.
So we kind of touched on it on the previous podcast, but one of the big things, we saw it from day one, a significant decrease in the administration time for the instance, and not having to upload them onto the NRLS. It just reports directly as soon as our reporter completes the form, presses submit. It then goes across. So there's been a significant amount of administration time that's helped with, and it means that our team can concentrate and the investigators can concentrate on making sure the data is accurate, rather than having kind of the uploading side of it. So if we notice something that's perhaps not as it should be, or something that's incorrect, or something we discover later on that makes the information that the reporter put through change, then we can update the system and then it replaces it on the LFPSE. So all of that kind of upload time, that's been a huge thing from day one that's helped.
And in terms of that implementation, both from ourselves and Marcus's team, I mean, is there anything that you would have done differently?
So, I mean, due to the timing of the implementation and the time it took for to do the NLS mapping, if we were to move system onto NLS mapping, it did kind of direct us down the path of going straight with the LFPSE at the same time. And I guess in truth, we probably would have done them separately and gone for Radar first, got it settled in a bit, and then slightly later on gone for the LFPSE section. But that said, Milton Keynes is kind of an innovative, we like to do things first. And so it kind of didn't phase us doing both at the same time. But probably in retrospect, we probably would have chosen to have done one first and done them as two separate change projects rather than doing two things at once in a way. But as I say, it was positive, and the responsiveness from both teams, the LFPSE and Radar, has been fantastic. So we've been able to provide feedback and work through things. It hasn't really phased us. And I guess the other thing we would have liked to have engaged staff more on the LFPSE before we went live. That's probably the other thing. I guess because it became part of the project quite early on, that was good. But I think we would have liked to have perhaps let them know a little bit more, I guess, because obviously the LFPSE is very focused on national learning. Mm-hmm. It's from a national perspective. And so the questions in there are a little bit different to what the day-to-day incident reporters are used to. So probably giving them a little bit more of a heads up around that would have been something we would have done in retrospect. But it's one of those things, because we're in an acute trust, and there's hospital pressures. We need to be flexible and adaptable. So the plan that we put in, we felt that we could still go with that. And we're keen to sort of share our experiences so that other trusts can learn from those things. So that's probably one of the things I would say to people looking to do it, is just to make sure that the staff are aware that that it is kind of a national perspective that it's looking at. So the questions aren't quite what they'd necessarily be used to filling in before moving across. Just more of a heads up than anything, so that they're prepared for that.
So, I mean, how did you go about doing that then? And almost, we mentioned it in the previous podcast. Did you sell the vision and the types of things that Marcus was talking about in terms of the why? Why is it we're capturing this data, and what difference is it going to make? How did you engage your employees?
Yeah, I mean, obviously they were already, generally they were aware of the NRLS and the reasonings behind that, and so obviously we could kind of add to that about the LFPSE. So the making sure that it's shared learning across the whole NHS, not just our trust. But one of the things we did do is kept the two forms kind of separate. So you would complete, you get a question, does this involve a patient? If it does, then the LFPSE form effectively appears for them to work through. Again, just so that we could kind of separate this and say, okay, these questions are from a national perspective, and then they can kind of go to next form, and then that's what Milton Keynes Hospital need for local learning, kind of probably sort of detail that's more relevant locally than from the national perspective. I guess some of the data that isn't required for LFPSE. So I think that's kind of one of the key things we did with the engagement. We have kept them quite separate. Obviously, it's relatively early days. We're only kind of about 5 months in, roughly. Yeah. So we're due to kind of review that. So it might be that we feel that now that people are kind of familiar with the system, that we look to perhaps change how we've got it. But I think it was the right decision to go with it as two separate forms, so that or two separate steps, if you like, on an incident form, so that it was easier for them, the users, to understand the different perspectives of the form and why those additional questions were there.
Yeah, I mean, I guess that's an important point as well, isn't it? This doesn't stop you from asking the questions that mean something locally. So you're not restricted to just answering the LFPSE question set. You can support that question set with things that mean more to you locally. And again, working with us as a team and working with Marcus, that's kind of been a big thing, isn't it, about how we use Radar to make sure we're still capturing that local information as well.
Yeah, that's right. I mean, and one of the challenges is always trying to make reporting quicker and easier. Yeah. I guess one of the things that did become apparent, because these are from a different perspective and different questions, what we haven't been able to do is reduce how long it takes. But I think if we hadn't gone with the LFPSE and we'd just had the Milton Keynes form, it would have been quicker and easier to report. But it's kind of, with those additional questions, it's kind of brought it up to about the same length of time. So I think, as we kind of touched on, making sure that staff are aware that this is all about learning, about making it safer, making improvements. So actually that bit of time, the time it takes to report is worth taking. Yes. Because obviously time's precious in all organisations, but particularly the NHS and in clinical areas that report the majority of the incidents. But actually, that if the time is well spent, then it's worth doing. So I think it's kind of finding that balance between trying to make it as short as possible, but also making sure we capture what we need to be able to learn and improve, because ultimately that's what the whole purpose of it is.
Yeah, absolutely. And I guess back to the vision thing of if you've communicated that as to what's the purpose behind what we're trying to do here, and ultimately, once you're starting to get information feeded back through an RLS, that should be showing you, or even other trusts giving you information where you can improve that you might not currently be doing. So yeah, I think you're right. Even if it does take a little bit longer, sometimes that's not necessarily a problem, as long as the outcome is the right outcome.
Yeah.
So a question for you and Marcus now, and you can be honest, even though I am here. So how was it kind of working kind of across teams and working with us at Radar Healthcare? I'll ask Paul that first.
Yeah. I wasn't sure if Marcus was going to answer that first, but no, that's fine. So I mean, from day one when we spoke to Radar, they talked about seeing it as a partnership. Rather than just us purchasing a system, if you like. So working together, working things through where there are things. And I would say kind of over a year on, that kind of relationship's still there. You can see it's more of a partnership than just being given a system to go ahead and work on. So that's really good. I mean, the team were always friendly, knowledgeable, and it's a pleasure to work with. And similar with NHS England, as I say, they've always been open to feedback and able to sort of be responsive and make changes that you needed to. So yeah, I've been overall really, really pleased.
Good, that's good to hear. And yourself, Marcus, how's it been working with Radar?
Yeah, no, it's fine. It's absolutely fine. No, it's I honestly I found it very easy, and so I think we developed almost like a kind of a good. I hope we have developed a good relationship and even a friendship out of this, and I believe that was due to the fact that when we first met and sat down to discuss what LFPSE was trying to achieve, and then we would be able to identify common interests and goals. So we were there trying to achieve kind of similar things. So it's about making the reporting experience better to the users and more rewarding and more valuable, and make the best of that time that they have to invest in providing the information. So we have that in common, and then that kind of help us to almost like we once you have the shared vision and we're clear that we both are trying to achieve similar things, then the collaboration came quite easy.
Good, that's good to hear. And I think you've hit the nail on the head there. It's about it is about that vision, and we're both ultimately trying to achieve the same goal, which is to reduce incidents and to improve patient safety. We're kind of going about it the same way. So that's good to hear. So another question for yourself, Marcus, in terms of kind of working with Milton Keynes then, and that kind of feedback mechanism, because I'm guessing as we onboard more trusts and obviously more people are moving over, that kind of work with Milton Keynes and that kind of engagement, how do you kind of, how did that go? And then I guess in future, how do you foresee that working with others who are coming on board?
Yeah, I think that is going really well, because first there was a relationship already there by them being under the NHS family, and they were already our kind of customers in the sense of by being an organization that already was reporting into the NRLS and already had some interactions with us, and so you were already there to support them when they were connected to the NRLS, and then and they were open to and brave to be the first ones to go live, and that was really exciting. And we start engaging with them and explain, look, this is we don't have all the answers yet, we're learning, and we're going to learn together in this process, and we're here to listen, we want to receive your feedback. This is and we honestly listening, and we are making change based on this on the feedback that we receive. And I think that's as Paul mentioned before, this is exactly what is happening. It's a very it's a very good collaboration, and still there's a lot more as we both are evolving, and then now they are best placed to help us with the use of data that now we're making available to them. So they are the first ones to provide data. And obviously, they're going to be the first one to make use of the data and the insights that we're able to generate with the data they are giving us. So that work will, and this partnership will evolve and continue.
Great. And probably final question then for yourself, Paul. In terms of another NHS trust going live, what advice would you give them from what you've learned working with Radar and the LFPSE team?
Yeah, so I think that we've covered a couple of them already. Like you say, it's about sort of sharing that vision with the staff so that they know why we're doing it. It's not just a change for change's sake. It's there's a real vision behind it, and it's all around patient safety. So it is important. I guess to say that you will be supported through it. I'm sure there were things in the background from a technical perspective, but from my experience, it was relatively smooth moving across to the LFPSE from NRLS. So I guess what I would say is, don't be afraid of it. It's something that it will involve. It will, there will be challenges. So you'll be able to provide feedback and make it smoother. But it was actually, relatively speaking, it was a quick and sort of smooth transfer across from our perspective. I'm sure there was a lot more work behind the scenes.
Perfectly smoothly our side as well. Okay, great. So in terms of kind of final question for you both, it's a what the health tech moment. So at the end of each episode, we're asking everybody to describe their what the health tech moment. It's basically a question for a bit of fun, and we're after kind of a weird or wonderful story that you might have experienced in kind of your work in health and social care. So I'll pick on you first, Paul. I don't know if you've got anything for us, but
yeah. Well, one of the things that kind of impacted me most, I think, was the first time I saw there was a TED talk by Dr. Brian Goldman called "Doctors Make Mistakes. Can we talk about it?" And it's a really, really powerful video where he shares kind of real life experiences where he's made mistakes and has tried to talk to people about it. And talk about culture, but you can't share, you can't talk about things. It really highlights the importance of being open and learning from mistakes. And it's so it's a really, really powerful video. It kind of tackles it through humor and sadness, all the different emotions when you look through it. But that kind of really struck a chord when I saw that, and it kind of really I guess links in with the LFPSE about the learning from, making sure we are sharing, we are learning, and making improvements. So yeah, that was a really, one of those wow moments. It's kind of that I came across.
Well, send us the link.
Yeah, we'll do. Yeah. So kind of use it in our training for incident reporting in the past as well, to sort of share it with staff. Definitely would recommend it to sort of people interested in kind of healthcare and sort of patient safety. But yes, really good.
Great, yeah. Please send the link over. I'll definitely have a watch of that. And then same question to yourself, Marcus.
Yeah, one of the things that I can think of is back in 2007, between 2007 and 2008, when we started to publish the numbers of incidents reported into the NRLS broken down by organization. So we put that on our website.
Yeah.
And then by that information being available to patients and public, it really kind of triggered the whole, I think, a change in the reporting culture across the NHS. Because after that, numbers start to increase, and every single organization that was not reporting, then they start reporting, and people really start paying attention into this because it was out there. So it's the power of sharing data and make the data available, and people really can see what's going on, who's reporting, who is not, what numbers, and all of that. There was a big shift in terms of reporting culture across the NHS from that moment when we published the data. So that was quite interesting, and this is one of the things that comes up to my mind.
Okay. Well, thank you both very much for your time. Can I leave it there? In terms of next week, we're going to hear from Hannah Wilkinson, Head of People and Culture at Radar Healthcare, about how a positive work culture can help health and social care organisations hire and retain staff. Please don't forget to rate and subscribe wherever you get your podcasts from. And if you have any questions for us or our guests, please email whatthehealthtech@radarhealthcare.com. I got it right this time. Thank you.